When we're treating our patients with diabetes in the rehab, we often categorize them as type 1 or type 2. And traditionally speaking, we would kind of think of type 1 as being what used to be called juvenile diabetes, where that person was diagnosed with diabetes as a child or at a young age. And then type 2 diabetes is something that you acquire later on in life and has other factors that are associated with it. Now, there's been some research in the last couple of years that shows that diabetes may in fact need to be categorized in more ways than just type 1 and type 2. This particular research has shown that there could be at least 5 different subtypes of diabetes that have different characteristics along the way. So there's 3 subtypes that are considered severe, and then there's 2 subtypes that are mild. So the 3 severe are called severe autoimmune. So that one would be more comparable to what we would consider now as type 1 diabetes. So that's an autoimmune disorder where the body is attacking the insulin producing cells so that the body just can't produce it because of the autoimmune process. Then there's also severe insulin deficient diabetes. So both of these, the 2 that I've mentioned so far, can be diagnosed at a younger age. But the difference with this, the second one, the insulin deficient subtype, is that the person doesn't have the characteristics of the autoimmune disorder. The body isn't attacking its cells so that it doesn't produce insulin. This person can produce insulin. There may not be enough insulin producing cells, or the cells themselves are just not efficient enough to produce enough insulin for the person. And then there can also be severe insulin resistant diabetes. So the person produces insulin, but their cells are resistant to it. So then the sugar hangs around for a while and can convert to fat. Then the person's tired and hungry all the time, so they eat. Eating triggers more insulin production, and then this vicious cycle keeps going on and on. Now, the 2 mild subtypes of diabetes are categorized as obesity-related and age-related. Now, what was interesting was that the mild age-related diabetes was the most commonly found diabetes among all of these 5 subtypes. So age by itself was a very significant risk factor for developing diabetes, regardless of any control of diet or exercise or lifestyle or anything like that. Now you might be asking, well, why is this important? They have diabetes. We know that they can't, their insulin and their sugar don't, work well together. It affects their body. Why is it so important that we categorize it in so many different ways? And what this particular research found, which I thought was interesting, was that the severe insulin resistant group of people were at higher risk of developing a diabetic kidney disease compared to the mild versions, the obesity related and the age related diabetes subgroups. But even though they were at higher risk of developing kidney disease, all of these people in this study were receiving very similar treatments, medically speaking. So they were getting the same medical management, but they're at higher risk for different complications. Another example in this study was that the severe insulin deficient group was at the highest risk for developing retinopathy. So what that means to me as a therapist is that if I knew more specifically what subtype of diabetes my patient would be categorized in, I could more specifically kind of funnel what my assessment would look like. I could screen them for retinopathy, or if there are other correlations that are found through further research, such as a certain subgroup being at higher risk for neuropathy, or any of the other complications that come along with diabetes. This could more specifically guide what I'm going to do as a therapist, what education I'm going to provide to my patient to prevent those complications from causing other problems. So This isn't something that is widely used quite yet. These aren't terms that we hear all the time out in the healthcare world, but there is definitely a lot of research going on to more clearly define what diabetes means for that individual so that we can more specifically find the right medical treatment that they need and the right therapeutic interventions that we can include into their care, into their plan of care.